Well, welcome everybody. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We're glad to have you. We have a huge number of people. This will be our biggest number, at least as far as people registered by far. And so we've got a lot of people on. Um, but I'll touch on that here in just a second. But we're just very blessed to have our friends at the Texas Homeless Network here to talk about a whole bunch of issues as it relates to homelessness and services and different aspects as that goes. A couple of housekeeping issues. If you're going to ask a question, if you'll please use the Q&A, if you would. It's just as easier to find the questions if they're not spread up in the chat with people's comments. You're more than welcome to provide comments in the chat, but if you would please put your questions in the Q&A, and that gives us the presenters a better chance at getting to them time efficiently. And so before we get started, I want to go over the CEU requirements. So if we could advance to the next slide, that would be great. Okay, for those of you that are joining us for CEUs, we're providing complimentary CEUs for licensed social workers and licensed professional counselors within the state of Texas. That's where we're licensed to do, or we're set up to do. If you have a different license in Texas, or you have a license outside of Texas, please note that you're more than welcome to go through the process and get a certificate and submit it to your jurisdiction. But just note that we are not set up with them, so there's no guarantee they'll take it. And there's really not a whole lot I can do if they don't. I will say that I've had people tell me they've had their jurisdictions take it. And I have received information or emails from different licensing jurisdictions asking for more information on the event, like a copy of the slides, in order to determine if it was acceptable. But you're more than welcome to do that. We're also offering certificates of attendance. The guidelines are the same for both. Today's webinar is worth 1.5 hours of CEU credits. You must attend the entire live webinar and the Q&A in order to qualify. You must also complete the Google survey. The Google evaluation survey should pop up as you close out of Zoom today. Zoom should ask you if you would like to take a short survey. That either you can take it there, or you will also be receiving a follow-up email from me tomorrow with that link in it as well. And so either way is just fine. But we ask everyone to take the survey. We want to hear your feedback. We want feedback from everyone. But in order to get any kind of certificate, you must take the survey. The link will be sent out to you in the follow-up email tomorrow. If you don't get it after you close out of Zoom today, we give you a little over a week to complete that. And then once we close that down, we don't open it back up. So please make sure you get it completed before the end of the day on the 7th. And then give us about 4 weeks, give us to the 7th of December to get those certificates out to you. It takes a while to get those done. So I'm going to turn it over to James. Jim Ward is going to talk about who's going to introduce his team and get us rolling.
Hey, thanks, Marty. Yeah, as Marty mentioned, my name is Jim Ward. I'm the Director of Planning here at Texas Homeless Network. I think Marty did a good job communicating the importance of this issue, obviously, to the folks at THN, but we're really glad that you could join us. I'm going to have the staff here at THN introduce themselves, and then we'll go ahead and get started. We have a fair amount of content to try to get through today. Just a real quick housekeeping item for the THN staff. I cannot see the chat, and so if there are questions in the chat, we'll need to bring those, or in the Q&A, we'll need to bring those forward. So without further ado, Jen, could you introduce yourself for us?
Yeah, sure, I can start. I'm Jen Beardsley, and I'm the local homeless coalition coordinator. Let me know if my internet goes out because I was kicked out earlier. But I can join by my phone, but I'll be explaining what a local homeless coalition is shortly. And I'll pass it to Hope.
Thanks, Jen. Hi there. I'm Hope Rogers. I use she, her pronouns. I'm an LMSW and I'm the Director of Systems Change at Texas Homeless Network. Happy to be here, and I'll pass it to Billy to introduce himself.
Hey everybody, my name is Billy Strew. My pronouns are he, him, and I am the Planning and Engagement Coordinator with Texas Homeless Network. And Jim, I'll pass it back to you.
The hope at the end of today's webinar is that folks will have a little bit of a better understanding of kind of how homeless services in Texas work. I was kind of monitoring the chat before we started. I see there's a lot of folks joining from all over the state. I just want to kind of level set real quick here. You will not leave this webinar with the silver bullet. Homelessness is a profoundly complex issue. The hope is that you will leave here with a better understanding about how to support someone in a housing crisis. So we're going to do that by reviewing a few things. One, who THN is, what we do, why that's relevant. We're going to review the concept of a continuum of care, why continuums of care exist, how they're formed. We're going to talk a little bit about federal funding to address homelessness, and then kind of more specifically how you might go about helping someone in a crisis. I did notice that there's a fair amount of folks from other metro areas, so from Dallas and Houston. So a lot of this content is going to be geared towards communities without a local continuum of care, which we'll talk about again later. But we hope that you'll stay, and you might be able to offer something in the chat to folks if if they're from your community. So with that, I'll move us forward to who THN is. So THN is a statewide nonprofit. If you're not familiar, our mission is to end homelessness by empowering communities to ensure that homelessness is rare, brief, and non-recurring. We do that through a few different activities. We provide support for the Texas Balance of State Continuum of Care, so we're the collaborative applicant and HMIS lead agency for that geography. We also provide general coordination and collaboration support to the other continuums of care in the state. There are a total of 11 distinct geographies where homelessness is kind of addressed in its own way. Additionally, we provide or advocate for long-term solutions through legislative efforts, focusing on things like affordable housing, increasing access to mental health services, and impactful policy changes at all levels of government. So that's either at the state capitol, and maybe with a city council member or county commissioner. But we really seek to advance policies that we believe are in the best interest of people experiencing homelessness. We also provide training and capacity building through workshops and ongoing support to agencies, specifically in the Balance of State, but in general, we host an annual statewide conference on ending homelessness. It's the only statewide conference in Texas that does that. That's focused exclusively on what it's going to take to address and end homelessness. I mentioned previously that we are the collaborative applicant and HMIS lead for the Texas Balance of State. So HMIS stands for Homeless Management Information System. So that is a database required by HUD for continuums to collect data on people experiencing homelessness and used to improve the services provided to those people and then report outcomes to HUD. So we are the entity in the Balance of State that is responsible for maintaining that database, pulling data, from it that is inputted by users all over the state, and then reporting that data to HUD and other interested parties. We also provide support to the Texas Balance of State around the coordinated entry system. So coordinated entry, if you're unfamiliar, is a method to ensure that folks that are most in need of services have access to those resources as quickly and efficiently as possible. But I think everything we do centers on this idea of collaboration and advocacy. Education that we think is really important, especially when we're talking about policymakers at the state and local level. Together, I think we can develop a system where homelessness is rare, brief, and non-recurring. I wanted to highlight a couple of things that we're going to be doing in the coming months that you may be interested in. So at Texas Homeless Network, we also organize the Homelessness Awareness Day. So this is a day held at the state capitol where we bring together advocates, service providers, individuals with lived expertise or lived experience to meet with legislators, their staff, and other policymakers. It's an opportunity to share stories and promote solutions to homelessness. So that will be held in March of 2025. We're gearing up for the 2025 legislative cycle. If you don't know, the state legislature operates on a biannual basis. So this is our opportunity to kind of catch legislators for the next 2 years in the state. So we'd love to see folks joining us at the Capitol, or potentially attending training to prepare for those conversations with legislators. Or if you're a person with lived expertise, those stories are incredibly powerful because your experience does matter. Those personal stories, I think we've learned over the years, can really help put a human face on what can seem to be this just like nebulous societal issue, and are really powerful tools for advocacy. So I think with that, I've sufficiently described who the Texas Homeless Network is. And I'm going to pass it over to Billy to talk more about what we're meaning when we talk about homelessness.
Thanks, Jim. I just posted in the chat a good link that can kind of help as a resource for what we're going to talk about here. I'm just looking at HUD's definition for homeless. But first, when talking about homelessness and housing, there's always a risk of being swarmed by acronyms. It's kind of, I think every industry or different, even just in nonprofit work, or especially when you get to the government level of different departments, there needs to be a whole mess of acronyms. So we're going to do our best to catch ourselves throughout this presentation, but please flag us in the chat if we've dropped an acronym that we didn't define, and our moderators will try to be sure to clarify these as we go along the presentation. So right off the bat, I already said HUD's definition of homeless. And so just in case you're not aware of this department, HUD is the Department of Housing and Urban Development, which is the government, the federal department that is in charge of our homeless response, affordable housing, and a whole other mess of things. And so when we're looking at a definition of homeless, it is important for us to pay attention to that, especially when it comes to federal funding, because definitions are what are used to kind of help determine eligibility, to prioritize specific populations, and where sometimes it can feel like, there's a lot more people that are in need of this funding. There might be a definition that's being more targeted because there's a specific more population that has more of a severe need at that time that federal funding is trying to address. And so that's why it's important to pay attention to definitions, and why we're going to spend just a little bit of time to kind of help you maybe understand it more. You're not going to remember all of it from this presentation, but hopefully it can at least illuminate some things. So with HUD's definition of homeless, they break down their definition into 4 categories. And I mentioned the categories because they will be mentioned again later in the presentation. I'm saying them out of order here because category 1 and category 4 are the main 2 that most federal funding that address the homeless response system use for eligibility and prioritization. So category 1 is what HUD calls literally homeless. which these are individuals and families that reside in a place that's not meant for human habitation. They're unsheltered, or it's individuals and families that are residing in temporary shelter. Temporary shelter can be a congregate or emergency shelter, transitional housing, or a hotel or motel that's paid by a charity or government assistance. And I mentioned that italics bit there on a hotel or motel, and we'll show why later. Category 4 is looking at individuals and families in households that are fleeing or attempting to flee domestic violence. The Violence Against Women's Act of 2022. This will bring some updates to this particular category to try to bring in more details regarding trauma and some, I think, really important developments that are good for what we work with regarding trying to address homelessness. But category 1 and category 4 are really important categories for us. All right, Jim, let's go on the next slide. And then we have category 2 and category 3. Category 2 is individuals and households that are at imminent risk of homelessness. There are some federal funding programs that do include category 2 as an eligible population, such as emergency housing vouchers, but it's a lot more limited. But these are people that are they're at risk of losing their residence within 14 days. And there's some other qualifications in there as well, which the resource can kind of help you see a little more detail. And then category 3 we bring up because this is the HUD's homeless definition kind of just points out the fact that there are other federal statutes under other departments that have their own specific definitions of homelessness, which we think is important to be aware of, because there's some things that those other statutes do not cover that HUD's definition does cover. And so this is where I'm going to pass it on to Jen.
Yeah, thanks, Billy. So exactly what Billy said, different departments within the federal government have different definitions of homelessness. And one we really want to point out is the difference between the Department of Housing and Urban Development's definition of homelessness and the Department of Education, because it's really easy to get those two confused. Unfortunately for HUD, or maybe it's fortunate because a lot more people would qualify for HUD programming, but they do not count folks that are doubled up or couch surfing for economic reasons. Like, so if they're crashing with friends or something like that, they would not be considered to be experiencing homelessness. But the Department of Education, if a student and their family were doing that, if they were, staying with their grandparents because of economic reasons, the Department of Education would count that family as experiencing homelessness so that they could access the Department of Education benefits. Like, for instance, like they could have free travel to the school of their choice. So if they had to move out of like the school district, they could still go to the same school of their choice. But again, that's the Department of Education, not HUD. Another difference is that HUD does not count people paying for their own hotel or motel stay. A lot of folks think of people staying in hotels or motels as experiencing homelessness, but if they are paying for their stay, HUD does not count those folks. But the Department of Education would count those folks. And so those students could get in touch with a homeless education liaison, or sometimes they're called McKinney-Vento liaisons, and access the rights that are given to those students. I will say for HUD, if a family or an individual is staying in a hotel or motel and a charity or a local government or a government entity is paying for their hotel stay or motel stay, then they would count as under the HUD definition as experiencing homelessness. So it's a little confusing, but just kind of where the source of the funds are coming from. And it can't be like family. I'm pretty sure it has to be from like an actual like program. And also HUD does not consider people living in overcrowded conditions to be experiencing homelessness, and substandard housing. So if their housing needs a lot of work, the Department of Education, and I'm trying to think of an example, like, I think,
Colonius and down in the valley is, I think, a good example of what HUD would consider to be substandard housing, but not eligible for HUD homeless assistance.
right, thank you, exactly. So like, they're not, hooked up to water necessarily, or they don't have access to electricity, I think. They would not be, considered to be experiencing homelessness under HUD's definition, but they would be able to access those rights under the Department of Education. Mhm. All right. And yeah.
Yeah, thanks, Jen. So we're going to switch gears a little bit and move into a high-level introduction and overview of what a continuum of care is. So a continuum of care, or COC, is kind of a multi-layered definition. In short, a COC is the group organized to carry out the responsibilities of the continuum of care program and promote a community-wide response and strategy to addressing homelessness for a defined geographic area. In addition, a COC is also a community-based planning network for homelessness and housing assistance, the geographic area covered by that planning network, as well as a program operated by HUD that seeks to address and end homelessness, which we'll be expanding on a little bit more in today's presentation. If you move us to the next slide. So this map represents the 11 COCs in the state of Texas. So each color on this map represents a different COC. And as you can see, most COCs are a single county or a small group of counties, which is really how they were designed to function. Usually centered around a major metropolitan area. And the balance of state covers everything in orange on this map, which is what Texas Homeless Network is the lead agency to. And the Texas balance of state covers 215 of Texas's 254 counties, which equates to about 84% of the state's landmass and about 40% of the state's population. So the Texas balance of state COC is primarily rural and suburban counties, with a couple of urban counties in the mix. And these are, in general, counties that don't have, or communities that don't have the resources to establish their own COC, or didn't at the time the Texas balance of state was developed. So because of our large geographic distribution, we rely pretty heavily on coordination with local housing crisis response systems to drive our work forward. Because unlike most COCs, our staff are not physically in the communities that we're serving on a day-to-day basis. And I'll say that every COC is subject to the same set of federal requirements, but each COC carries out those requirements a little bit differently. But at its core, the intent is that COCs have the ability to understand the unique needs of their regions as it relates to homelessness response, and can develop and organize a plan to address homelessness in their region, which looks a lot different for a single county COC compared to larger COCs like the Texas balance of state. Move to the next slide. There's the Texas balance of state. Okay, so there are a number of responsibilities that COCs are required to carry out. Again, this looks a little bit different for every COC. This is not a full list of requirements, but kind of the key requirements. A complete list of requirements can be found in the Code of Federal Regulations, which I am sure is linked somewhere in this presentation if you're interested in learning more. Some of the key activities of a COC include leading the charge to plan to address homelessness in a geographic area, which is generally informed in close partnership with providers and other stakeholders in the COC to ensure that the plan represents the diverse needs and resources within a specific COC. COCs are also responsible for hosting and facilitating an annual application process for continuum of care funding in alignment with HUD's funding opportunities and requirements, which we'll speak more to later in this presentation. We also organize an annual point in time count and a housing inventory count, which I hope that folks in the room are familiar with. A point in time count is essentially an annual census of people experiencing homelessness in a given community and is intended to provide a snapshot of who is experiencing homelessness in a given night, in a given community, and what their needs and experiences are. Similarly, the housing inventory count is essentially a tally of the number of beds and units available on a given night that are dedicated to people experiencing homelessness. So those two data sets are used together to determine the number of people who are experiencing homelessness and the number of resources that are available to those people on a given night to help inform planning around homelessness and funding to address homelessness. As Jim mentioned earlier, we're also the host agency to the Homeless Management Information System, or HMIS, for our COC, which is the information system utilized to collect client-level data and data on the provision of housing and services provided to people experiencing or at risk of homelessness. And lastly, we're responsible for developing and maintaining a coordinated entry system, which is the process by which people experiencing homelessness can quickly access resources within the housing crisis response system and then be assessed and referred and prioritized for those services based on need. So a little bit more about the Texas Balance of State Continuum of Care. Our mission statement is that the Texas Balance of State Continuum of Care develops system-level responses and coordinates local community strategies that prevent and end homelessness and increase housing instability. So before we switch gears a little bit, I want to talk about what it means to end homelessness. So when we talk about ending homelessness, we don't necessarily mean that no one will experience homelessness again in a given community. Instead, what we mean is that every community has a response that ensures homelessness is prevented whenever possible or is otherwise a rare, brief, and non-reoccurring experience. So essentially what this means is that every community has the resources and structures and funding in place to prevent homelessness or to quickly rehouse people who are experiencing homelessness. There are a number of communities nationally that have achieved what's called functional zero for homelessness, which basically means that they have more people exiting homelessness than entering homelessness on a given day or month within their local housing crisis response system. Generally, this is for a specific subpopulation like veterans or families or people experiencing chronic homelessness. So with that, I will pass it back to Jen. All right.
Yeah, thanks, Hope. All right, so now we're going to kind of talk about the historical development of COCs, like why the federal government created this program. I find that like hearing the why is really helpful in understanding what a COC is and what they do. So as Hope mentioned earlier, this program really is geared toward urban areas or like smaller community or like a few counties or something like that. And that is because when the federal government created this program in about, I believe it was the early, like the mid 1990s, they required communities to come together and apply to become recognized as a continuum of care by the Department of Housing and Urban Development. They basically had to show that they already had the network in place to operate a continuum of care. So what ended up happening was that a lot of communities were left out. They didn't have those networks. They didn't have the capacity to apply for those, which is a problem because in order to apply for continuum of care program grant funding, you have to be a part of a continuum of care. And also you miss out on the access to technical assistance, which is just a fancy way of saying if you have like a question about how to design like a homeless program or shelter or something like that, you would have people that you could ask, generally for free. It depends on the continuum of care. Because I do really, sorry, sometimes I get into the weeds. But about 10 years later, the federal government realized that having or requiring communities to come together to apply to be a continuum of care created an unequal access to COC funding and also support to just develop a network or housing crisis response system in your community. So they decided to create something called a balance of state continuum of care. Okay, and so balance of state just means that within a state, any community that was not already part of a continuum of care was automatically part of the balance of state continuum of care. All right, and with that we can go, yeah, there we go. And so I think this was a question, or it's a question I get a lot. But why do some counties have their own COC and others fall under the balance of state? That is why. And I do like to mention that some continuums of care did opt to join the balance of state. About a third of our local homeless coalitions were previously their own continuums of care, including Denton County, because of all, like, basically we were able to take off a lot of like HUD reporting and the background work that communities need to do. And it helps communities really develop plans that work for them without necessarily having to worry about HUD requirements when it comes to like planning that, unless you have a COC program funded thing, and then you do have to worry about HUD requirements. Right, and can you go to the next slide, please?
Hey, Jen, I think I'm actually going to pause this here for a second because one of the questions that I get pretty frequently is, we're part of the balance of state. Well, we want to form our own continuum of care. What does that look like? What would a community have to do now in 2024 to form a continuum? It's a reasonable question. It is not a straightforward one, as you can probably imagine when working with the federal government, especially HUD. Very little is as straightforward as it would appear on the surface. But there are really 5 things that a community would need to demonstrate to HUD before they would recognize that geography as a continuum of care. So those are pretty much the basic requirements of a continuum, right? Like you need to demonstrate to HUD that you have assembled a group of stakeholders that is representative of the required components of a continuum of care. So that would be like your local nonprofits, your local public housing authority, local governments, maybe if there's a healthcare district in that county, or your local mental health authority. And then I think not least of which are folks with actual lived expertise of homelessness. And that group would be formed to develop kind of the collaborative planning group that HUD looks for and that Hope mentioned on the previous slide, a few slides back, in terms of like one of the core purposes of the continuum of care is to promote this community-wide commitment to addressing homelessness. So that's one, right? Like you got to get everyone at the table. 2, you'd have to develop a governance charter. So all of the activities that are required by HUD are also required to be documented in a Continuum of Care's governance charter. So the Balance of State governance charter is on our website. I believe that's probably similar for most of the COCs in this state, if not all. But that charter outlines the roles, decision-making processes, conflict of interest policies, recusal process if there is a conflict of interest. And then that framework is intended to ensure transparency and accountability to stakeholders that maybe weren't part of that original group assembled for the purpose of developing a continuum of care. Similarly related, but distinct from forming a governance charter and assembling a committee, the COC needs to have a board or steering committee that is designated by that group of stakeholders to oversee the operations, monitor performance, align strategies with HUD's priorities and guidelines. And then that would need to be codified into the governance charter. So that is different from like a nonprofit board of directors. So I'll use THN as an example, right? THN as an agency has a board of directors that our CEO and staff report to. Additionally, the Texas Balance of State Continuum of Care has a standalone or distinct group called the Continuum of Care Board that oversee the COC's operations, performance of projects, that funding opportunity that Jen was describing. And so those groups are not synonymous, right? And that's something that we hear a lot of is like, well, why doesn't THN just do X? Or, the balance of state is THN, and really they're not synonymous, right? So that's what HUD's trying to communicate here through this, establishing the governance charter and establishing a COC board. In addition, and I think Hope kind of spoke to this earlier, HUD would want to see evidence that there is already a coordinated entry system or evidence of a plan to implement a coordinated entry system in the proposed geography of the new continuum. I'm going to use a county at random. This is not a real life situation, but let's just say, for example, Laredo down in Webb County wanted to form their own continuum of care. They would need to demonstrate to HUD that their coordinated entry system would satisfy the requirements of HUD's coordinated entry systems, of which there are numerous documented in notices over the last 10 years. But they would need to be able to sufficiently convince HUD that coordinated entry system will satisfy the requirement to design a system to ensure that individuals experiencing homelessness are assessed and referred to appropriate housing and services based on their unique needs and vulnerabilities. Additionally, a community would need to have a homeless management information system. This one you would think would probably be pretty easy. However, it is not. HMISs are software platforms that are not provided by the federal government, but are required by the federal government. So what that has resulted is in a patchwork of for-profit software vendors around the United States that have developed their own implementations of coordinated entry. For example, in the state of Texas, not all 11 of the COCs on the screen here are using the same HMIS system, right? There are at least 5 different vendors in the state of Texas, and where COCs share the same vendor, their systems do not automatically talk to one another, right? They are distinct and separate from one another. So HUD would look to see that HMIS system is functional, that you have a contract in place with the vendor, that you have policies and procedures, that you have a data quality plan, et cetera, et cetera. Kind of quite a bit of work to do on the front end without the HMIS funding. And then additionally, HUD would want to see what they call system performance measure data over the last 2-year cycle. So system performance measures look at things like the length of time someone's experiencing homelessness, the frequency at which people return to homelessness in a given geographic area. What happened there? Trying to scroll in my notes and I did something altogether different. Pardon me. Yeah, so again, system performance measures are really just HUD's way of tracking the performance of a continuum of care. So when a community is now, like, let's use that web example or the Laredo example, they would need to provide evidence to HUD that they have system performance measure data for that geography. That's something that generally is not one-to-one, right? Like let's say we're using Client Track, which we are, and Webb County wanted to use Service Point. It would not be as simple as just exporting it from Client Track and uploading it to Service Point. It is significantly more involved because of that patchwork of vendors that I described, and each one using a different process for how they code the same elements within the homeless management information system. So once a community has satisfied all those requirements, they would apply for recognition to HUD to be recognized as a continuum of care. HUD will look to see, did they satisfy all these requirements? And then if they do, it's literally that simple that HUD will then recognize them as a continuum of care. It's important to note that that does not automatically come with anything funding related. There is that a funding cycle that a COC would need to kind of align this effort with to ensure that, after the recognition, you have some actionable way to move the process forward, because at that point, HUD would expect that you are, its own continuum of care. We would have to update this map to show, a 12th COC in Webb County, et cetera. So it seems like it would be simple, and it's not that complicated, but it's not easy either. I will pass it back to Jen now that I've kind of gone off the rails on that. If you can tell, I think about this sort of thing a lot.
No, yeah, that was great. Yeah, thank you, Jim. That was really well put. And also, I would like to add, imagine doing everything that he just said with 2 people, because the planning funding is in part determined by like the population you're serving. So if you're covering one county, you'll have like a smaller planning budget. I see there's some folks from Corpus Christi on the call, and the Homeless Coalition in Corpus regaled me with tales of stress when they were their own continuum of care, and they had to basically one person was doing all of that, and then they had to add. I could go on and on, but yeah, so yeah, definitely a lot of work. All right, but yeah, thank you, Jim. All right. Okay, so local homeless coalitions in the Texas Balance of State Continuum of Care. So like Hope said, we cover 84%, 87% of the landmass. So that huge area, as you could imagine, it's too much planning for us as one agency to do. Usually smaller continuums of care function as the planning unit, like the collaborative applicant / lead agency for a smaller COC that was maybe one, like a city or a county or a few counties. It's a lot easier for them to take on connecting all the relevant actors that they need to bring into their coverage area and do planning. So this is clearly not the case in the Texas Balance of State Continuum of Care. And actually, we're not the only Balance of State Continuum of Care that relies on local planning groups. We call ours local homeless coalitions, but Arizona has some, other states I can't remember do as well. But basically we divide our geographies, or actually you all self appoint. We don't tell people what to cover. We let communities come together and decide what's best for them, what geography they would like to cover if they want to form a local homeless coalition. But they come together and form those smaller planning entities, and they carry out a lot of really important work. So for instance, they bring together local service providers in their area and stakeholders and advocates. And they also make sure that folks in that area, in those areas, have a shared awareness of what resources are available and are kept up to date. Because as some people might know, in homeless services, there is a lot of turnover. So they kind of provide that education to people coming in. And also they carry out the point in time count, which is a really important local data collection that we talked about earlier. All right, and as the Continuum of Care Collaborative applicant, Texas Homeless Network, we provide developmental support to local homeless coalitions. Let's see. All right. So you can find out if you belong to a continuum of care or a local homeless coalition by visiting the website that you see there. And then when you get to that landing page, there's a link that says click here to access current local homeless coalition contact information. So you can see if there's a local homeless coalition in your area or if you're covered by a different continuum of care. Thank you. All right, and
Yeah, I can jump in here.
Yeah, thanks,
Jen,
Billy.
thanks everybody
thanks.
for sharing all the questions that you have in the chat. Please keep them coming, and we're going to do our best to continue to answer as we can. Jim and the other panelists, I think we can combine a couple of these questions just while we're kind of taking a break here to maybe help address. I see a couple of questions that really talk about access to homeless shelters and sometimes the barriers that people can face, like, individuals and families that have pets and trying to figure out what to do with them. If a homeless shelter doesn't accept them, but also people that might have specific health needs, the elderly, others that might not feel like the homeless shelter is accommodating to particular needs or accessible for those specific needs. Does anybody on the panel have some things to share about those issues?
Yeah, I mean, I think just kind of first, in general, access to shelter in the state of Texas is one, woefully underfunded. We're going to talk about that a little bit in terms of like the federal dollars available to support emergency shelter. And where shelters do exist, they're very often not federally funded, right? So we're talking about shelters that are operated by faith-based networks or other entities that have their own kind of processes for determining what is appropriate for their shelter. I don't know. I haven't gotten this question in quite a while, so I don't know exactly where you're at. But Lauren, or excuse me, I don't know who exactly asked that question, but if yeah, I think that would be that feels like one, something that's not going to have an immediate resolution, right? It certainly is going to depend on how willing the shelter is to work with the family. Potentially there might be some foster options for short-term foster options. I think one of the things that we're really wary of is entering emergency shelter without an exit strategy, right? Because I think we recognize, and especially from looking at the data, right, it is very possible for someone to enter an emergency shelter and then spend a lot of time there, right? So that fostering situation may not be a palatable one for the family experiencing instability. But I think, getting with the local homeless coalition to identify the prevalence of this as a barrier to people experiencing homelessness in your community. And really, we would look to the emergency shelter to identify strategies for how they're going to meet the needs of folks that are unable to access because of either medical needs or ADA requirements or gender identity or sexual orientation or possession of pets or possessions in general, right? Like that is a much bigger conversation. So I'll say that on some of those things, if they're federally funded, like example, sexual identity and gender orientation, they are federally prohibited from discriminating based on those qualities. But the same does not exist for pets, unfortunately. So it's really kind of in a patchwork way what shelters do how to address people in need of assistance with pets. Again, not a silver bullet, not a great or inspiring answer, but is kind of is the case in Texas. I see some other questions. I don't know, can everyone see the Q&A pod?
You can see.
Or do I need to like read them off, or can we just answer like Sandra's question or
That's what
Jasmine's?
I
Does that
was
make sense?
thinking. Yeah, I was thinking I would read Sandra's question, and I know we'll address this one, then we'll see if we need to move on, and we'll continue
Okay.
to try to answer them in the box as well. But
Yep.
Sandra Brown asks, people often live on a couch in someone's home. It's difficult for agencies to qualify them as homeless because they have shelter, and many don't think of them as homeless, as they can provide an address. It's not their address. It is just where they're staying. How do we help these individuals and support those who are providing shelter to friends and families so they are not sleeping in their car?
Again, this is a really good one, a really important situation one, and I think it goes back to the slide that Jen shared relative to the HUD definition and the Department of Education definition, and often why you see wildly different numbers between the number of families that a school district is identifying as experiencing homelessness. It's precisely because of this issue right here. People are couch surfing or living doubled up. And so the short answer is, those folks would not in general qualify for HUD assistance, but they may qualify for other non-HUD dollars potentially. Or I guess I should take that back. They may qualify for like an emergency solutions grant funding for, homelessness prevention or rapid rehousing, dependent on the specifics of their situation. But again, HUD has prioritized their limited resources to folks living in either Category 1 or Category 4 homelessness in general. So again, in short, there's no immediate solution for someone that's living doubled up or otherwise in a overcrowded situation. If, however, that family does find themselves in an unsheltered situation, whether that's either in, like you mentioned, like a car, or the family that they're doubled up with says, I've had enough and you're moving out to the garage, that could potentially qualify someone as living in a place not meant for human habitation, depending on the characteristics of that specific situation. So it really comes down often to a case-by-case assessment of that family and their situation. I do want to be cognizant of time because it's 11:27 and we have a lot more content to get through. So I'm going to move us along. Folks that are asking questions, please keep asking them. And if we're not able to respond to them verbally, we'll get Marty a list of responses after the presentation is over, so that folks will get some response to their question.
That's perfect.
Yep. So, and we wanted to talk about federal funding as it relates to addressing homelessness. I'm going to pass it over to Billy here to discuss kind of the environment of federal funding.
Thanks, Jim. Yeah, we're just going to give a bird's eye view for you here in this slide, because for the purposes of this presentation, it's, a lot of these specific items that you see listed in these boxes are standalone webinars of their own, if that. You can go even deeper than just a single webinar for each one of these. But I think this is a helpful image to at least give a bird's eye view of what federal funding attempts to address. And so hopefully this gives you an idea of the role of federal funding in housing crisis response systems. So kind of three different rings of this circle that you see here. Federal funding is trying to address access to services. And so these interventions for that can include street outreach, emergency shelter, and the coordinated entry system and diversion system. You can also address the homelessness prevention, trying to keep people from falling into homelessness in the first place. And interventions like this include the actual term homelessness prevention, as well as just the different practices that there are regarding home habitability and accessibility for people with disabilities, for those types of modifications and so forth. Another big chunk of this whole puzzle is housing interventions themselves for people that have fallen into homelessness or are fleeing, depending on what category they are in the definition that we discussed. And these interventions include rapid rehousing, permanent supportive housing, and other permanent housing programs that are often administered through public housing authorities like HUD, Veterans Assistance Supportive Housing, HUD-VASH, and just all the programs that public housing authorities administer as well. And so I want to briefly touch on the idea that housing first is the guiding model and approach for all of these interventions. So federal funding seeks to supplement what communities are already doing. They're not meant to be the cure-all. That communities are not meant to just see federal funding as to be the resource is going to swoop in and completely solve and end homelessness, but meant to supplement the work that we're supposed to already be doing together. And so this guiding model of housing first is an evidence-based approach with decades of research to show its effectiveness. The model aims to create immediate access to housing with no preconditions, emphasizing an individual's choice, their self-determination, and their specific and individual needs. So I think one way that's helpful to look at it to kind of illustrate the spirit of housing first is the idea of Maslow's hierarchy of needs. And I don't have a slide, we don't have an illustration for it, but I think a lot of people may be familiar with it. But it's this idea that, at least in the concept of housing is one of the base needs that must be fulfilled in order to move on, for individuals and households and families to move on to adequately address other pressing needs, such as mental health and substance use and employment, and all the way on to self-actualization. Housing is the first step and the main thing we should be focusing on. And we've got to get the unhoused housed so that we can be able to move on and adequately address the other issues and what people might try to call underlying causes and so forth. And so that housing first approach is the guiding model for all of these interventions for this federal funding that seeks to come in and supplement the work that communities are already working to do. Okay, Jim, you can go on.
Jim, you're muted if you're talking.
You're so great. Thank you. I don't know what I would do without Hope, y'all. So basically, HUD, essentially, there's two methods of allocation for these funds. So there's competitive grants and formula grants. We're going to talk briefly about competitive and formula. I'm not going to go through every single funding source on this list. I'm going to target on the continuum of care and the emergency solutions grant programs. This is also not the extent of the federal government's investment in addressing homelessness. There are other projects that are operated by the Health and Human Services Commission, like the Projects for Assistance in Transition from Homelessness, or PATH. And then there are still others that are operated by HUD that can be used for homelessness, but are not required to be used for homelessness. Things like the Community Services Block Grant and other programs of similar nature. So the Continuum of Care program is HUD's largest investment nationally. They invest about $3.6 billion to address homelessness. They will distribute that funding to nonprofit organizations, states, local governments, and will fund a variety of permanent housing interventions. We're going to talk more about that in terms of how that actually gets to the community here in just a second. But the other that I wanted to target, because I think it is important, especially in the state of Texas, is the Emergency Solutions Grant Program. It is a significantly smaller pool of funding, and it is a formula grant, meaning that it is awarded to certain eligible local and state governments based on formula and not necessarily a competitive ask. However, even though it is allocated directly to certain jurisdictions, it is often allocated further to subrecipients or nonprofits doing the work competitively. It is between the two, COC and ESG, they are the primary vehicles for HUD to get money into communities to address homelessness. So how ESG and COC are distributed, I wanted to kind of give a brief overview about what that would look like. So for the Continuum of Care program, HUD would release a notice of funding opportunity. Local continuums, so entities like Texas Homeless Network for the Balance Estate would issue our own request for proposals and solicit project applications. Once we've solicited those project applications, we have policies that guide all this stuff. So I'm kind of trying to get through this so we can get to what I feel like are probably more pressing content slides. But we would rank projects depending on local and HUD priorities, and then submit those recommendations up to HUD. I think the important thing there is that it is a recommendation, not a guarantee. So one of the common misnomers that I hear frequently is, hey, the Balance Estate recommended me for X project, but I didn't get it. What's up with that? And so I think it boils back down to the way that the process works is, again, a recommendation to HUD, and then HUD is the ultimate decision maker on whether or not a particular agency will be funded in a given grant cycle. ESG is a little bit different because, as I mentioned previously, those funds are allocated directly to states, metro cities, urban areas, and territories based on formula. In the Balance Estate, there are 8 ESG jurisdictions. So in that entire 215 county, there are 8 jurisdictions. The 9th is the state of Texas. So the Texas Department of Housing and Community Affairs gets their own tranche of emergency solutions grant funding annually, and then using the Texas Administrative Code allocates that funding out to the different continuum of care geographies, and applicants within those geographies apply directly to TDHCA. So this is something that is, again, written into state code, and does not necessarily mean that the funding that the state receives for ESG is going to go to an area where there is not a local allocation of ESG. So I just wanted to put that out there. If you're interested in learning more about that, or like really getting into the weeds, I would welcome an email to try to help you sort through the mess of how all this stuff works. But the short of it is, the funds are going to local governments or state governments, and then those local governments are, through a competitive procurement process, identifying subrecipients that will administer those funds in the local level. I think, one of the things that I also hear frequently is why, I'm in Liberty County, right? I saw someone from Liberty County earlier. Why isn't there any continuum of care funding in my community? So even though, we describe that every county in the state is part of a continuum of care, it doesn't necessarily translate to, especially in our kind of more rural or sparsely populated communities, they're part of the Balance Estate, but they may not be actively participating. So maybe there isn't a local homeless coalition because of limited local capacity or coordination challenges. And so that's kind of like the first step, right? Is getting in part of a local collaborative to address homelessness is kind of one of the prerequisites to a community accessing either COC or ESG funding in most cases. I think, again, the capacity issue cannot be overstated, because I think, many communities in the state lack the infrastructure, like emergency shelters or nonprofits, even to effectively manage or use those funds. So it is it's an issue that I think HUD is interested in addressing. Recently, they had a funding competition that was exclusively for communities that were identified as rural. So it is something that HUD is aware of and seeks to address. That's, again, one of those situations where, it's not going to be resolved overnight. Additionally, I kind of mentioned that state level prioritization of TDHCA. So states have broad autonomy to establish those allocations however they see fit. And so not all counties will necessarily be prioritized within a continuum's geography for emergency solutions grant. They may be prioritizing their ESG funding for urban areas or regions of the state with higher homelessness rates, or other factors that are a priority for the officials at TDHCA and the elected officials in the state. I think we kind of mentioned, right, who's eligible to administer COC and ESG, but basically if you have 501c3 nonprofit status, you are almost certainly eligible to administer ESG or COC. I think the distinction is eligible and competitive may not be synonymous. And so if that's something that you're interested in, if you're hearing all this and like, I want to know more, please, we'll have a contact slide at the end. We really want to talk with you and figure out how we can get something going in your community. With that, I'm going to pass it over to Hope to talk about eligibility for just a second.
Yeah, thanks, Jim. So in terms of who is eligible under these programs, and I want to point out there's a typo in the title of this slide. This should say Continuum of Care and Emergency Solutions Grant Program eligibility. But both of these program types serve folks who are experiencing Category 1 or Category 4 homelessness. Again, Category 1 homelessness are people who are experiencing literal homelessness, meaning they're living in an emergency shelter, living outside or in their car or in a place not meant for human habitation. This does not include people who are couch surfing or people who are living doubled up. And then Category 4 homelessness includes persons who are actively fleeing or attempting to flee domestic violence, sexual assault, stalking, dating violence, or other dangerous or life-threatening conditions that relate to violence that an individual experienced in their primary nighttime residence, including human trafficking. And unlike the COC program, the ESG program can also serve folks who are at risk of homelessness, which is a multi-part definition, but essentially includes people or families that have an annual income below 30% of the median family income for that area, and who also lack sufficient resources or support networks that would prevent them from experiencing homelessness, and who are experiencing unstable housing, such as living doubled up, living in a hotel, having to move frequently, or who have received a written notice to vacate their unit within 21 days. So we can move on to the next slide. So the two most common housing interventions or components that the COC program funds include rapid rehousing and permanent supportive housing, both of which offer a housing or rental subsidy, wraparound supportive services, and holistic case management that are intended to support an individual or family in their journey to move from homelessness to permanent housing, with the intent that these services and case management that's offered will help them retain their housing on a long-term basis when the assistance stops. Both of these project types generally are delivered through what's called tenant-based rental assistance, meaning the rental subsidy is tied to the individual or family and not a specific housing unit. So that rental subsidy follows the individual or family in the private rental market rather than staying with that specific unit. Rapid housing tends to have the broadest reach in terms of who is eligible and who's a good fit for this project type. So this can serve anyone who is experiencing literal homelessness. And generally speaking, these are households who may be experiencing homelessness for the first time, or who haven't experienced homelessness on a long-term basis, and have the resources and ability to stabilize in permanent housing after 24 months of assistance. Permanent supportive housing, on the other hand, is a non-time limited housing intervention, meaning this program type is available to persons for as long as they need to prevent a return to homelessness. This is really similar to housing choice vouchers or Section 8 housing that I think most folks are probably familiar with. This project type is exclusively targeted to people who are experiencing chronic homelessness, which means a person that has experienced literal homelessness for 12 consecutive months, or 4 periods of homelessness within a 3-year period that total 12 months, and has a disability. So these are generally the people who are the most vulnerable in a given community and need longer-term support to retain their housing and prevent a return to homelessness. And then similar to the COC program, the ESG program also funds rapid rehousing as a permanent supportive housing intervention. But where they're different is that the ESG program also funds operating, improving, or renovating emergency shelters, as well as street outreach activities to go out into communities and into encampments and identify people who are experiencing homelessness and try to connect them to permanent housing or supportive services. As well as homelessness prevention, which is funding that is intended to prevent an eviction or an episode of homelessness, generally through emergency rental assistance and case management. And with that, I will pass it back to Jen.
Yeah, thanks, Hope. All right. So now we're gonna kind of talk about how you can help a person in front of you that may be experiencing homelessness. Primarily with online stuff, because luckily a lot of information is online these days. But you can check and see if you have a local continuum of care, which I think we're gonna drop that link in the chat. And if you somehow lose this link, which is, I lose links all the time, you can always Google like continuum of care, homeless, and then your county. All right, and once you find your continuum of care lead agency, like for instance, if you live in Parker County, your lead agency for the continuum of care is ahomewithhope.org. And most of the these websites now have like get help sections or like homeless help cards. So you can just really look at their website to get the resources for the person sitting in front of you. You can also keep an eye out for a local helpline to call or text. That's something that's really becoming popular with continuums of care that are a little bit smaller. And some also have online forms that you can submit. Yeah, so that can be great. All right. But if you're located in the Texas Balance of State continuum of care, you would first want to check to see if a local homeless coalition exists in your community. So you could visit our website, go, and on the next slide, we have a reminder of how to get to that spot. But you would want to look in, so it's a big spreadsheet, and it's one of the columns is labeled county resources, contacts, and lists. In order to find resources in your area, you would want to look, thank you so much. You would want to look in that column. So it's column C. Yeah. Yeah, thank you so much. Oh, and actually stay there for a second. And if you scroll down, I think almost all of them do have county contacts and lists. But if there are any that do not have a list, you can reach out to the local homeless coalition or LHC contact, and they can put you in touch with folks that may be able to assist. And you can also always, oh, I'm sorry. If you live in an area that does not have a local homeless coalition, you can, oh, I think that's the next slide. I'm getting ahead of myself, sorry. Here we go. Thank you so much for navigating. All right. There we go. Yeah, there are luckily a lot of resources sometimes, not always. But I would start by visiting findhelp.org or 211texas.org. They usually list various like food banks or like housing or shelters that may or may not be in your area. Honestly, if you're in a really rural area, you'll find that a lot of the resources are located in major urban areas. So just kind of be prepared for that. You can also call 211. And also be prepared for a very long introduction. Like you have to listen to a very long kind of thing before you get to talk to a person. But 211 often knows, has information on like local churches that might be able to help. And of course, food banks and things like that. I would also strongly suggest looking up who your local mental health authority is, which you can find or LMHA. A lot of them have resource lists that provide things like how you can get help for housing, rental assistance, and as well as basic needs, food, medical care, all that good stuff. So not every local mental health authority has these lists, or sometimes when they're serving really rural counties, they might just have 2 resources listed for that county. I've seen that quite a bit. But there are also, as Marty would know, there are affordable housing lists that you can look up, specifically with that area, ADRC housing. So maybe that person, if you're serving someone that may be able to apply for affordable housing, you could definitely like give them that list or help them in whatever way that you can. Another really good resource that often create resource lists for local areas are United Ways. So definitely make sure you Google your local United Way to see if they have any good resource lists. And then community action agencies are also really good at maintaining resource lists. Again, not every community action agency lists resources that might be specific to what the person you're serving needs, which is why we have so many things that you can Google. Oh, and a lot more public housing authorities are starting to create resource lists if they have websites, which I will say a lot of there are rural public housing authorities that may not have websites. Sometimes you have to call them, but it's definitely worth a Google search to see if those resource lists exist. All right. And if you find that you've Googled these things, and I actually recently met with a county where they did all these things, and literally they didn't have any social services in the county whatsoever. I would definitely encourage you to start thinking about forming a local homeless coalition. That way you couldn't fund future capacity. This is definitely an endeavor that takes several years. Don't think of it like, oh, if we started a local homeless coalition this year, next year, we're gonna have all the services. That would be amazing and I would love that, but that's usually not how it goes. But you would want to connect with folks with funding. So we've seen a lot of different communities access the folks that they already know in their communities in order to get programs started. Listed are some examples. So one local homeless coalition in a really rural area outside of Dallas, they have no social services in that area. They actually use a funding collaborative that's made entirely of faith communities or churches. And they were able to use that funding to house or to hotel families during the pandemic. And they still use that funding to help people get out of homelessness locally. Like they work with a local landlord. It's really amazing to see. You also want to look for nonprofit networking organizations. A lot of counties have those, and folks might not know that they exist, or maybe you do. But definitely Googling just like the name of your county and then nonprofit networking usually gets the results you're looking for. Those folks are usually really interested in starting local homeless coalitions and also developing capacity to assist people experiencing homelessness, because they are often seeing the people coming in that need that assistance but are unable to provide that, so that they're really good groups to network with. Local and regional foundations can also be really instrumental in building future funding capacity. New Braunfels County, they have a really amazing local or regional foundation that has been instrumental in helping the local homeless coalition there establish shelter. They used to be a community that did not want shelter. Their local city was like, if we build it, they will come, which is unfortunately a common misconception around the state. And I will say it did take years, but eventually they got there. So make sure you definitely research your local foundations and see if anybody already has connections with them. Also, local mental health authorities. I will say local mental health authorities don't always have the funding to get something started right away, but usually they're very, very interested in starting in helping build a local homeless coalition, because they're serving the people experiencing homelessness, and they can be really instrumental in talking to local governments and also councils of governments and even their executive directors to create funds to eventually build out services. Another really amazing partner are Area United Ways. They have, for folks that might not know, United Ways really specialize in providing grants. And so partnering with the United Way and getting them involved in a local homeless coalition, if you're able to like demonstrate that homelessness is an issue in their area through, you know, the point in time count, you can really they can be really instrumental in providing grants that they may have, and then also helping you advocate for other agencies or local governments to put in funding as well. And another amazing partner you can have are community action agencies. So typically more rural community action agencies might focus on like providing utility assistance and things like that. But we have seen community action agencies that were previously kind of focused on keeping people housed or weatherization and things like that. With the point in time count and with the formation of a local homeless coalition, they were able to show their executive directors that we do need to allocate funding to address homelessness. And so we've seen that happen, and that's been really, that's been amazing. Again, it takes years, not going to happen overnight, but there are ways to build future capacity. Yeah.
Thanks, Jen. Hey, I just want to acknowledge we have just a couple of minutes left. We're gonna stop right at the top of the hour, but we can stay on afterwards. So really quickly, just in terms of like soft skills about how to support people experiencing homelessness, right? One, I think the impact of trauma on a person who's experiencing housing instability, certainly someone who's experiencing issues like unsheltered homelessness or domestic violence or addiction or eviction even can create chronic stress. And so we know, from the research that chronic stress affects mental health, decision-making, and physical well-being over time. So just a friendly reminder, right? Like the person in front of you has a whole life behind them, and that your decision or your interactions with them in that moment can positively impact the remainder of their lives. Certainly the experience that they're going to have with housing and service providers in the next steps of their journey. It is helpful to know about the families, right? Like what kind of experiences they have. Are they fleeing domestic violence, right? Are they a veteran? Because those things can be really helpful when identifying what types of resources might be available to them, right? So when you're engaging with folks, remember we're asking open-ended questions, you're, tailoring your response to their responses, and practicing active listening, doing our best for our nonverbal cues to not pass judgment if you're holding any of that in that interaction. But I think really importantly is avoid making promises that you can't keep, right? Like people in crisis will often rely on any commitment that you make, and unfulfilled promises worsen their mental health potentially and can create or reduce engagement with future services. So let's, be honest, be realistic, set expectations up front about what you can and cannot do. And then, I mean, I think that will set you up well, even if you don't have anything to offer people, right? Like we had just spent the last hour and a half talking about the lack of resources in the state of Texas. And it's very possible that you're going to encounter people that you have nothing for. And I think being honest about that so that they can adjust their strategy as necessary. I think, just kind of general preparation is important for your interactions, but I think we're at the top of the hour, so I'm gonna save this. You can read it on the slide. There's not a lot of like novel ideas on this slide here, but I would just encourage people to go to these training resources here if you regularly interact with the public, specifically the Ryan Dowd Homeless Librarian trainings for de-escalation are really, really helpful. And with that, I'm going to pass it over to Marty.
Thank you. That's great. I just want to make sure that I catch anybody that got on that may not have got up right at the beginning, but are looking for CEUs. We're providing today complimentary CEUs for licensed social workers and licensed professional counselors within the state of Texas. Please note that if you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process, get a certificate, and submit it to your jurisdiction. But please note there's no guarantee they'll take those. I have had people tell me that they've taken them in different cases. I've actually had jurisdictions reach out to me for more information, which is absolutely fine as well. We're also giving away certificates of attendance for anybody who would like those. The guidelines for those are the same as they are for the CEUs. Today's webinar is worth 1.5 hours of CEU credits. You must have completed the entire live webinar and stayed on until the scheduled end time, which is right as we speak. And then you must complete the Google survey. That's a requirement that is actually a CEU requirement, believe it or not, but it's a requirement for us to get the information we need to send you a certificate. So we ask everybody to complete the Google survey. That information and feedback is helpful for us, but please note that if you like any kind of certificate, you must complete that. The survey link will go out in a follow-up email tomorrow. If it doesn't get if you don't catch it today as you close out of Zoom, and it'll stay up for about 5 days, 5 to 7 days. Please give us about 4 weeks to get those certificates out to you. Those certificates will be delivered by email to you. If you don't have them by the 12th of December, please reach out to me and I'll be happy to check into that for you. So I'm going to turn it back over to Jim. And Jim, you guys can take as much time as you guys are comfortable with and have to give, but thank you so very much.
Thanks, Marty. Yeah, I know that, this is just such an important issue to us. I think for obvious reasons, we had a lot of stuff that we wanted to communicate today, so we can stick around as needed. I did just want to kind of plug these last couple of slides for getting involved, right? If you are in the balance estate, right, like we want you at the table. So we've listed a few resources here. They're going to go out separately. I believe there's going to be like a one-pager with links as well for folks that are interested in kind of getting engaged with the continuum of care or with your local homeless coalition and hopefully with THN through our statewide advocacy work. And with that, actually, I think we're there. Follow-up questions for us, y'all. You can reach anyone that was on this webinar by emailing txboscoc@thn.org. We'll put that in the chat as well. That's a shared mailbox that my team monitors and can distribute questions or asks accordingly, according to the team that it relates to. But yeah, I mean, I think that's really it as far as content goes. I know we have a few things going on. It looks like in the chat, or excuse me, in the Q&A. So I will I'll take a look at this stuff real quick. It looks like, yeah, if you start, so Sandra posted, if you start a local homeless coalition, please let your Chamber of Commerce 211 and Find Help know so that they can help connect you with other resources in your area. I'm a faith community nurse and help connect church ministries with local resources. There's so much out there, but nobody knows they exist. Yeah, a meeting is already happening, etc. Even if your group does not directly provide a resource, it will help those with resources to connect with you. Yeah, that's great, Sandra. What county are you in, if you don't mind? And then I'm looking through here. So Blanca says, are there similar agencies as Housing Forward in Tarrant County? So yeah, again, and I see Hope's responding to that, like typing an answer, but Housing Forward is the collaborative applicant for Tarrant County, Fort Worth, right? So they act in a similar capacity as THN, albeit on a a 2-county scale. So they are able to do things that we are just simply not able to do because of our scope. But they fill a similar role in the community. Every continuum has their own, quote, housing forward, if you will, to varying degrees of impact and capacity. But yes, there are.
Hey, Jim.
Yes.
Actually, Housing Forward is in Dallas.
Oh, did I
The
say Fort
Tarrant
Worth?
County Homeless Coalition is in.
Thank you. Yeah. So essentially the same would apply, right? Like Housing Forward in Dallas, Tarrant County Homeless Coalition in Fort Worth, and then in Houston, The Way Home, and the Houston Coalition for the Homeless. So there are a number of kind of coordinating agencies. If you're in the balance of state, again, like that local homeless coalition is kind of the extension of the continuum of care in your community. And so they are also a great resource available to you.
Jim, does the
Homeless.
balance of state have a monthly membership meeting or something like that that
Great
people can
question.
attend?
Yeah, so Mary and I have been talking about that. We do not do monthly, we do biannual. So we do twice a year. We'll do a spring and a fall membership meeting, but we have been talking about potentially increasing the frequency of those. But right now they're twice annually. The next one will be in somewhere around March, April, and then the fall is usually connected to the state conference on ending homelessness. But I think if folks wanted to stay connected with the Balance Estate, we do send out a monthly newsletter for folks to stay connected with what's going on, that has a variety of opportunities and information that we think is relevant for the membership to know. And so, that's certainly an option. And I think if you, hopefully in the chat, where is that link at? I want to say it's on slide 38. That's that last one there. Sign up for newsletters. We'll let you sign up for anything THN related, to include the BOS newsletter.
Very good. Well,
I'm
you
not
guys
seeing. Yeah, I'm not seeing. I was just going to say, I'm not seeing any other questions. We're happy to continue the conversation offline. If you have anything that you feel like is outstanding or feedback for us, please feel free to reach out at txboscoc@thn.org. And with that, I'll turn it back over to Marty.
Great. Jim, Billy, Jen, Hope, thank you so very much. Mary, appreciate you as well. I know I got you in late, but sorry about that. but thank you all so much, you guys. It was really truly impressive, and I think a lot of people got a lot of information out of it. I did myself, and hopefully we can do something else soon with some and homing in on some of the areas that people had questions with, and that as you guys said, there's just a lot of information just down that track. So so that would be great. But I sincerely appreciate your help, and y'all, I sincerely appreciate everybody for joining us. Please don't forget to do your evaluations. Those are really important to both of us for information and for the information to get you CEUs or certificates if you're looking for that.
Oh, Marty, I do have a kind of a procedural question. Will we, I know that for folks that joined kind of later in the presentation, will we send the slide deck out with those links after the fact?
I do 2 follow-up emails. The
Okay.
first follow-up email will go out with a link to the slides, plus it will go out with several of the links you guys have put on, like the link I'll try to include the link that you just pointed out for signing up for the newsletter, those kind of things. I'll try to include those in the body of the newsletter, but the link to these slides will also be in there. And then the second follow-up email I send out once we've posted the recording to our YouTube channel, it will go out to everyone who registered. The first one only goes out to everyone who attended. The second one goes out to everyone who registered for today's event.
Got it. Thanks, Marty.
And if there's not anything else, I'm sure nobody has anything else they have to do today. So, but thank you all so very much. We certainly appreciate it.
Real quick, one more, Marty, in the chat or in the Q&A. NTAS or NTADS does regular webinars. Can folks find more about that by emailing you?
Yeah, you'll actually, just by having signed up for today's webinar, you'll get on our sheet. We do about anywhere from 10 to 20 webinars each month on various topics. And so once you've signed up for this, you'll get on our email list, and you'll get information about all of those all of those webinars that we have coming up.
Got it. Thank you so much.
Thank you. Well, thank you all, and you all have just an incredibly great day.
You as well.
Thanks,
Bye-bye.
y'all.
Thanks, everybody.
Bye, y'all.
Okay.